Recording to start, everybody. We go. Hi, everyone. So, formally, welcome to HTA's online webinar. My name is Danish Khan, and I am the product manager here at HTA, which basically means that all of the training programs that we have, I work with my team and the subject matter experts to design them for you guys. And that's the reason why I'm leading this webinar. And I've been leading all the webinars for the past few months where I talk about all these products that we have and all the features of those products. And you guys can ask any questions that you guys may have about the products, and I'll be more than happy to answer that. Like familiarize yourself with the whole Zoom chat features and the question answer features. Feel free to use the chat during the webinar as well. But remember that we'll have a question answer session at the end of the webinar, which would be probably the ideal time to ask any questions that you guys may have. So this is a live healthcare bootcamp webinar by Health Tech Academy. And I will start off by this very high level overview of what HTA is. So we are a training provider providing healthcare training programs, and we currently have more than 1,500 active students who are enrolled in one of the programs here at HTA. We have more than 25 coaches that are available to you guys one-on-one. And you guys can schedule sessions with them as part of your program. We have more than 10 on-demand boot camps, which I'll be covering today in detail. And we have almost 100% student placement rate. This is for the students who have completed the program from HTA, passed the certification exam, and they have also completed their clinical requirements if there were any. And if they have completed all these three things, all of them who completed these three things, they have been placed. So that's how our job placement rate is 100%. Our headquarters are in Austin, but we are a global team based majorly in the all around the US, but then we also have a few team members which are based abroad as well. So question answer feature, once again, get familiarized to it, use it whenever you need. My team is here to answer the questions during the webinar as well. And if there's anything that I am talking about and you guys would like to correct me, or you guys want to ask something relevant to that particular topic, feel free to use the chat box and ask the question. So one very important announcement is that if you stick till the end of the webinar, there is an announcement related to tuition discounts and deals, which will be very, very useful for all of you guys. So stick around till the end of the webinar. So as far as the content of this webinar is concerned, I'll be starting off by talking about HTA in a little more detail. Then I'll talk about the future of allied healthcare. Then I'm going to talk about the boot camps that we offer, then the admission process, then the financing options, and then the career services, which is very, very critical part of our product and the services that we offer. We have some student testimonials that we would want you guys to watch and listen to or read, so that you guys can see what other students are saying about their experience here at HTA. And then we have question answer sessions at the end of the webinar. So I will start off with HTA. So who we are and what we do, we are a leader in flexible and accessible online training for more than 20 years. And we build programs around the growing areas of allied healthcare here at HTA. As I shared, we are headquartered in Austin, Texas. And Health Tech Academy aims to transform the healthcare education and staffing with a focus on excellence, innovation, and personalized learning. Our flexible healthcare bootcamps are delivered 100% online, self-paced, and tailored to fit seamlessly into your schedule. We collaborate with different partners all across the US to provide you with the best services in every possible way. Our vision and mission is, similar to the introduction that I've given, but, I would give you guys 5-10 seconds to just read through it, understand what we really stand for. If you choose to become part of HTA, you guys will know that we absolutely mean it when we say all these things that we are saying here in our vision and in our mission statement. How do our boot camps work, which is probably the more relevant thing that you guys would like to know about, and that is we work with the industry experts who have been working in the industry for at least more than 10 years, then different universities and employers and healthcare partners. And we join hands with all of these parties to create industry aligned boot camps, which is designed by my team. And our boot camps are divided into different modules, courses, lessons, and each of those lessons and courses have recorded content, text-based content that you guys can go through, but it's all self-paced, which means that you can complete it in your own schedule, anywhere, anytime. So the three main key aspects of our boot camps or the certification programs are that these are on demand, which means whenever you want to start a program, you can start it. If you enroll today, you can start the program tomorrow. So these are on demand, self-paced. You can complete the whole program in 1 month if you want, if you're spending 30, 40 hours a week, or you can complete it in 3 months or 4 months if you're spending about 10 to 15 to 20 hours a week. And then we also have one-on-one coaching sessions, which are again not anything that we have scheduled already in your calendar. You choose the time yourself by looking at the schedule available inside the platform for the coaches. And these are one-on-one live sessions. Every student get 5 coaching sessions with with their coaches. That's how we build our programs and how we offer our programs. But then if you go to our partners, which is something very, very crucial, which I think all of you guys would be interested to know, we have a lot of partners, including universities, certifying bodies like NCCT, NHA, and a lot of our programs are approved through the Texas Workforce Commission as well. And if you go on our website, you will see a lot more healthcare partners, which are basically employers, potential employers for all of you guys. And when it comes to the flexibility of program, I mean, that is something that I've already shared, but just to reiterate it a little more, our boot camps are designed to suit your lifestyle. So it doesn't matter if you are working full time, or you're a full time mom, or you are studying full time, whatever it is, you can complete one of our programs because it's self paced, it's super duper flexible. Our programs are designed for a range of experience levels, which means that if you are a beginner, if you don't have any healthcare experience, we have a lot of programs that you guys can enroll into. You don't need to relocate to any place. You can be where you are for the programs. And the trainings that we offer are 100% online. Of course, if there is a clinical requirement for a particular program, you will have to go in person, but that's not something which is part of the training program. The training program is absolutely online. You learn everything online. But for clinicals, of course, if that's a requirement, you'll have to go in person to the clinic, whichever one you find or whichever one we have an affiliation with and we recommend you to. And that takes me to the second part of the webinar, which is future of allied healthcare. Now, why is it important to understand the future of allied healthcare? All of you guys here, I assume, are thinking about starting a career in the healthcare space or growing in the healthcare space. So it is very, very important to understand how does the present look like in the allied healthcare space and how the future is going to look like. And the future is absolutely spectacular when it comes to how AI is being used into the healthcare world, and how it's already being used, but it's going to improve every passing month. And when you look at these trends that we have in 2024 and in the next 10, 15, 20 years, we see that there's a lot of involvement of tech and AI, and a lot of automation is taking place. And that should never scare you and make you feel like you will be irrelevant to the field, because we will always need humans. Human intervention is going to be very, very important to train all these AI models or automations. And at the end of the day, the tech is also developed by humans, and the tech is reviewed by the humans if it's really serving the purpose that it was made for or not. So for that reason, it's important to understand the trends. And in order to really catch your future is to be working in the industry. You start in the industry, you keep growing, you keep learning and keep evolving as the growth happens. So if you look at the trends in the industry right now. We have surgical technology trends where there are robotic assisted surgery proficiency, which is a very, very critical skill that a lot of people have. And if they have it, that's very useful in the industry. A lot of automations in the pharmacy industry. A lot of health record management systems are using AI because that makes things a lot more easier, and it can also predict a lot of things in the future as well. And of course, it can make mistakes, and that's why the human person needs to be there. But it can really create better operational efficiency if we use all these AI and automation softwares that are available. Similarly, in sterile processing trends. So these trends are there for you guys to understand how the world is going to look like in the allied healthcare space in the future. And if this is something that excites you, you need to become part of one of our training programs and start your healthcare career tomorrow. And Now comes the third and the longest part of our webinar, which is our boot camps. So I'm going to talk about, I think, these 10, 11, 12 boot camps that we offer. A lot of the information is going to be repetitive. So don't worry about that. I wouldn't repeat everything that I'm saying, but things which are crucial and they require reiteration, I will keep doing that. So most of our programs are 16 weeks, some are shorter, so keep an eye on that. So our surgical technologist program, which is TSC Tech in Surgery certification by NCCT. So that's the certification that you get once you complete this program and you pass the certification exam. So this is offered through NCCT. Our tuition for this program is $3,450. But we do have discounts for anybody who is paying upfront. So if you're paying $3,450 today, you will get a pretty good discount on that. And our monthly payment options start from $266. You can also have fortnightly payments or weekly payments, and you can divide this number into four and start paying that if that makes things easier for you. In terms of eligibility, you need a high school diploma or any equivalent qualification. You need an internet. You need to know how to browse on internet. You need to know how to use online applications. That these are bare minimum requirements. But along with that, one requirement which is not written over here, and that is very important for surgical technology students, is that you need to have some kind of background in the medical field for this program. Now, that's not a requirement for you in order to be certified, but that is highly recommended because students who do not have healthcare or medical background academically or professionally, they face a lot more difficulties to find externships or to find job roles for as a surgical technologist. So that is recommended. But if you don't have any kind of experience, then sterile processing technician is a good step towards surgical technology. And I'll come to that program later on. In terms of our offerings that we have, the program is completely self-paced online. So you get access to our online program. You get access to one-on-one coaching sessions with the coach. We give you certification exam preparation course. After our training program, there's an official self-assessment by NCCT that you guys can enroll into and really see if you're ready to appear for the actual certification exam or not. So that is there, that is covered. Your exam voucher, the actual exam certification exam, is covered in this price as well. You get the ebook, you get the skills videos, you get all the career support, you get the student services support. So pretty much everything is covered in this price. Now, this column is something which is very, very important for you guys to understand, and that's restricted states. So for some of the states, this certification that we are offering, which is TSC Tech in Surgery certification by NCCT, this is not acceptable in these particular states. So if you are in one of these states, do not enroll into this program because you will still be certified, but you will not be able to work in these states. So if you still choose to be certified, then you need to confirm two things. Number one, you need to find an employer which is okay for you to have NCCT even if you are in this state, and then you can enroll. Or if you are planning to shift to a state, move to a state where this program is not restricted, then you can choose to enroll as well. Are there any courses where you can do a payment plan in Maryland? Yes, there are programs where we have payment plans. I mean, surgical technology is one of those programs. Do you offer patient care technician? Yes, you will get there. I didn't see the program for radiology tech. Do you still offer that program? So radiology tech is not a program that we offer separately. It's not part of any of our training programs. Radiology technology is usually required for our dental assistant students, but that is something that they have to do separately. We currently do not offer red tech. You can download the syllabus from our website. So if you go to the Search Tech web page, you'll be able to download the syllabus. So I'm not going to open that here. And that takes me to the next program. Okay, so one thing that I missed here for the surgical technology program, and that's clinical requirements. So for this program, you are required to complete 125 clinical cases, and it has its own requirements, which are important to understand. If you choose to enroll into this program, make sure you know that these are 125 clinical cases that you have to complete in order to be fully certified as a surge tech. The demand for this role is very, very high, but the market is also a little bit of saturate. There is a lot of saturation because there are a lot of people who are trying to find externships. So it's a little difficult. But if you are determined and you are ready to do all the hard work to find the clinicals, you can absolutely do it. But remember the requirements that I've shared earlier. Medical assistant, on the other hand, is a program where you do not have any kind of clinical requirements. You can literally enroll online, appear for the certification exam online, get certified, and start looking for the role straight away. Although, if you can find any kind of clinical externship experiences, that can be very useful for you when you try to find job roles. This program is also 16 weeks long. This certification is clinical certified clinical medical assistant by NHA. The tuition is upfront $3,450, which is the same as Surge Tech. And I'll repeat myself, you can pay on monthly basis or fortnightly basis or weekly basis. It's very much up to you. Eligibility requirements are the same. You don't need to have any kind of healthcare background. That is not even recommended. If you are a beginner, you don't have anything related to healthcare in the past and in academics or as as a professional, don't worry about it. You can absolutely enroll into this program. The offerings are the same, and there are only two restricted states where this certification CCMA is not accepted. You can download the syllabus from the website. Okay, so what is a clinical case? Clinical case is basically where you go find a clinic or a hospital where the surgeries happen, and you have to be an observer. You have to be the first scrub tech or second scrub tech. There is a detailed guide on from NCCT which you have to follow. But clinical case is basically you going into a hospital or clinic, and you are assisting in the surgery just like you'll be doing it as a surge tech. But those cases are important because if you don't do them, you don't really understand everything on a practical basis. And it makes things difficult for you, not just for your actual career, but also for the certification exam. So if you complete our training program, the next recommended thing is find an externship site. Once you have the externship site, complete the clinicals, and then appear for the certification exam. Although you can appear for the certification exam, and by the way, I'm talking about Surge Tech again because I saw these questions. So it's recommended that you complete the clinical cases and then appear for the certification exam. How do we complete the clinicals? Okay, I see a lot of questions. So what I'm going to do is that I'm going to get back to all of these questions. So don't worry about it. I will absolutely get back to them at the end. The next program is Patient Care Technician, CPCT, Certified Patient Care Technician. Again, the certification is by NHA. Almost all of the details are the same. You don't need any kind of experience in healthcare. You can enroll into this program. There is one more state as compared to medical assistant where this program is restricted, which is North Dakota. So if you are from one of these states, we do not recommend you to enroll into this program. You can download the syllabus from our website. If you go to healthtechacademy.org, you will find the bootcamps page, and there you can find the patient care technician role. Oh, by the way, about the medical assistant certification program that we have over here, we recently, just 1 week ago, we launched another medical assistant program where there are a few offerings which are not part of it. So like exam voucher is not part of it, certification exam preparation is not part of it, and one-on-one coaching is not part of it, but rest of the things are there. You can still complete the whole program, and the price is much cheaper. So if you check it out on the website, if you are interested in medical assistant program, I think you'll be absolutely happy to see that offer on the website. um, Patient care technician I've covered. Pharmacy technician, so this is certified pharmacy technician by NHA. We offer two certifications for pharmacy technician. One is the pharmacy technician program that we have, and the other one is pharmacy technician professional program, where the certification is offered through PTCB, and I'll cover that program in a bit. The requirements are the same, eligibility is the same, tuition is the same, offerings are the same, but the restricted states are a lot more as compared to medical assistant and patient care technician. So make sure you have a look at it if you are interested in enrolling pharmacy technician um, training program here at HTA. And you can download the syllabus for this program from the website as well. And the next program is dental assistant. So the dental assistant program is registered dental assistant certification through AMT. The upfront fee is the same, and the monthly installment option is there. You can pay fortnightly and weekly as well. Eligibility requirements are the same as well. And there is no requirement for you to have any kind of healthcare background. So this program is absolutely for beginners, and dental assistant role, in my opinion, and that's just my opinion, that's how I've observed things. I've seen dental assistants graduates here at HTA find jobs a lot easier than a lot of other programs, and don't hold me accountable for this, but that's how I've seen it. And the offerings are the same, and the restricted states, you can see if you are from these 6 states, do not enroll into this program, because these 6 states do not accept this certification in order to work as a dental assistant in that state. You can download the syllabus from the website. All right, so dental assistant program does not have any clinical requirements. Pharmacy technician does not have a clinical requirement. Patient care technician does not have a clinical requirement. Medical assistant does not have a clinical requirement. Surgical technology is the only program that I've covered till now which has clinical requirement. Now comes the second program which has clinical requirements, and that's sterile processing technician, which is CRCST certification offered through HSPA. It's a 16 weeks long program. Now, one thing that I want to make clear is that when I say 16 weeks, that's an average. And the assumption is that you're spending about 15 hours a week on the program. If you spend a lot more time on weekly basis, you can absolutely complete it in a much shorter span of time. But 16 weeks is an average duration that we have seen for our students to complete the programs. The tuition is the same, eligibility is the same. For Surge Tech, I said that it's recommended that you have some kind of background in healthcare. For sterile processing technician, it's nothing like that. Sterile processing technician role is very close to the Surge Tech role. I mean, the roles are very different, but they work very closely with Surge Techs, because you can imagine that as a Surge Tech, you are assisting the surgeon during the surgery. And you are an assistant while that whole procedure is being done. Now, the sterile processing technician's role is one step before the Surge Tech role, where you are ensuring the whole sterilization process during the surgery, before the surgery, and after the surgery. And that's the process that you have. And if you have experience as sterile processing technician, the chances are that it would be a lot more easier for you to find a Surge Tech role. So for that reason, if you do not have a background and you still want to become a Surge Tech, you can start with this program. In as far as our offerings are concerned, they are the same. And the best part is there are no restricted states. You can be part of any state and you can enroll into this program. Again, you can download the syllabus from the website. For this program, there is a clinical requirement of 400 hours of clinical experience that you need before you are fully certified as a sterile processing technician. Now, don't be worried about 400 hours. I mean, these are a lot of hours, and it would take you 6 to 8 months to complete those requirements, but that is needed. And that's the case. That's a standard. Everybody needs it in order to work as a sterile processing technician, just like everybody needs it for surgical technologists. They have to complete those 125 cases. And 125 cases also take about the same amount of time, 6 months to 8 months as well. You can download the syllabus from the website. And that takes me to the next program. And this is the first program where the price is now no longer $3,450. This program is phlebotomy technician. It's a much shorter program, and our upfront is $2,000, and the monthly payment options start from $141, and you can also pay fortnightly and weekly basis, whatever you want to choose. This certification is through NHA. The certification is called Certified Phlebotomy Technician, CPT. The eligibility requirements are the same, the offerings are the same, and there are these 6 states where this program is restricted. This program is a shorter program, and you can say, if you compare it to medical assistant, for example, this is a little bit easier because this is focused on just one part of it, whereas a medical assistant probably has some basic skills of a phlebotomy technician as well. I mean, they're not certified as a phlebotomy technician, but there are a lot more concepts and skills that they have to learn in order to become a medical assistant. But phlebotomy technician, it's a niche where you get specialized, and then you can grow into a role of a medical assistant and so on and so forth. A lot of people do medical assistant first, and then they become, they get the phlebotomy technician certification as well, and then they get the EKG certification as well. So it depends whatever road you want to choose, but this can be the first certification, and this is a lot cheaper, but a lot cheaper and easier and shorter. But remember, for phlebotomy technician, you have clinical hours. The clinical hours requirements is pretty manageable. It's not as much as sterile processing or search tech. You can find the details on the website, and you can also download the syllabus for this program on the website as well. And that takes me to my next program, which is medical coding. So medical coding is CPC, a CPCA certification by AAPC. We are an approved training provider through AAPC. This is a 14 to 16 weeks. Again, this is a tentative estimated duration that we have. It takes about 14 to 16 weeks. The tuition is the same as the previous programs that we covered. Eligibility is the same. Offerings are the same, and there are no restricted states. Now, medical coding, this is a professional medical coding program, which is kind of advanced level. The kind of concepts that are covered, they're advanced. So if you do not have any kind of experience in the healthcare sector, or any kind of medical background, it would absolutely be recommended to think about medical billing and coding certification first, and then moving on to becoming a medical coder afterwards, and then you can do the CPC certification. So the other certification that we offer is medical billing and coding, which is Certified Billing and Coding Specialist by NHA, CBCS by NHA. This certification is 12 weeks long. It's a bit shorter. The cost is the same. The offerings are the same. I mean, for medical coding program, you not only get the ebook, you also get the coding manuals. They are shipped to you. Same goes for medical billing and coding. You still get the coding manuals for the medical billing and coding program because they are required for the exam that you have to appear for. You don't need it for the entire program. You just need it for the last course that we have it as part of this program. And then there are no restricted states for this program. Again, you can download the syllabus from the website. All right, the next program is Healthcare IT. This is a 16 weeks long program. Again, this is estimated. We offer 2 certifications as part of this program. So the exam voucher for 2 certifications are covered. One is IT Fundamental Plus by CompTIA, and one is CEHRS, which is Certified Electronic Health Record Specialist by NHA. The Upfront cost is $3,950. And if you pay upfront, you get a really good discount. You can find the details on the website. And the monthly payment options start from $322, but you can also pay fortnightly or on weekly basis. The eligibility requirements are the same, offerings are the same, but of course you get two ebooks instead of one. You get two exam vouchers instead of one. And then there are four restricted states where this program is not available. There are no requirements at all for any kind of clinical requirements or anything like that. You can download the syllabus for this program on the website. Now, one thing that I would like to say about this program is that it not only prepares you for these two certification exams, but it also gives you basics of project management, data science, data literacy. So it basically equips you in order to become a well-rounded healthcare IT professional, where you not only have these two certifications, but you know a lot more, so that you can think about another certification like healthcare information management, KHIM certifications in the future. And this really sets up the right base for that one. You can download the syllabus from the website. The next program is Medical Health Record Specialist, which is one of the certifications that we have as part of the Healthcare IT program. And this is Certified Electronic Health Record Specialist by NHA. This is restricted in 4 states. So if you want to do one of the certifications, then you can enroll in this one, which is Medical Health Record Specialist. The upfront cost for this program is $2,000. And of course, if you pay upfront, you get a discount. The duration, which is estimated, is 12 weeks. And the monthly payment options start from $141. You can also pay fortnightly and weekly, and you can download the syllabus from the website. EKG is the shortest program that we have, although the cost is pretty much the same. It's $2,000. The requirements are the same, the offerings are the same, but the good thing is that there are no restricted states. However, there are clinical requirements for the EKG technician program. So remember this: surgical technology, sterile processing technician, phlebotomy technician, and EKG technician. These are the 4 programs where you have clinical requirements, where if you really have to look at it, sterile processing and surgical technology clinical requirements take a lot longer to be completed. And they are, of course, advanced level roles, kind of advanced level roles as compared to EKG and phlebotomy technician roles, where the certification requirements in terms of the clinicals are much lesser as compared to those 2 programs. So you can find all the details about the clinical requirements on the website, and you can download the syllabus from the website as well. And I think we have last 2 programs that I'm going to cover now. So healthcare leadership is a certification which does not offer any other industry recognized certification. We offer our own in-house certification for this program, and this is for anybody who is already in the healthcare space and they want to grow into becoming a manager, or they are already a manager and they are going to become a senior manager, and they want to learn the basics for that, and they want to learn different leadership skills, keeping the context of healthcare sector in mind. Then this program is designed for those people. There are no restricted states, of course, and the eligibility requirements are the same. This is for anybody, even if you are somebody who's a beginner and they want to learn leadership skills which are relevant to this industry, so you can grow faster in your roles. This is absolutely for you. You can download the syllabus from the website as well. Now, remember, I talked about the pharmacy technician professional certification. I told you that we offer 2 certification for pharmacy technician roles. And this is the second one. The duration is the same. The certification is not HTA. I'm sorry, this is a problem on our end. We shouldn't have done this. And the restricted states are not none. So please refer to the website. You will find the exact information on the website. But we do offer the second certification for our pharmacy technician role, and that is certified pharmacy technician by PTCB. We are approved institute and recognized by PTCB, so you can find our details on the PTCB website as well. You can download the syllabus for this program from the website as well. All right, I think this took me a lot longer than what I thought, but that's fine. How does the application process work? So if you are interested in any of these roles, you can schedule a call with an admission advisor. I'll give you a QR code at the end, so you can scan that. and you can schedule a call with the admission advisor. You can discuss the bootcamp details and the eligibility requirements, and then you pay your tuition and you start your program. Um, so it's a very, very simple process. Now, when it comes to the financing options, we have upfront payment where you get a very good discount if you pay for the entire program upfront. We also have monthly installment options, which are available through financing partners like Fortify, Edley, Selime, and a few others. And you can find the details on our website. Of course, it depends on them approving your request. So that's there. Then we have study now, pay later option through a firm. You can talk to the admission advisor if you're interested in taking that option, and they will review your eligibility. Then we have military education benefits, MICA, which is for eligible students which may be able to apply for military funding towards the cost of their boot camps. And then we have Workforce Innovation Opportunity Act, which is WIOVA, and we have with us Chester, who would like to talk about WIOVA funding and the opportunities that we have for our students about that. So I'll give it over to Chester.
All right. Hello, everyone. I'm Chester, and I'm with Health Tech Academy. And the WIOA funding stands, the acronym is WIOA, and it stands for Workforce Innovation Opportunity Act. Um, Half of it is designed for people who are either out of work through no fault of their own, um, laid off, let go, collecting unemployment, um, that type of stuff, or the other half is if you make less than $37,250 dollars per year, and you have at least one child in your household, or if you're single and you make less than that. So it's below 200% of the poverty level at the federal level. Your state's local workforce offices usually administer the funding for this grant, and then all you need to do is reach out to myself or someone on my team, and then we can help you get an appointment over with the local workforce office in order to access those fundings. It typically goes where you go in for an orientation, which takes about 30 to 45 minutes. They explain to you all of the benefits that can go along with them not only paying for the training directly, which they would pay directly to HTA. You won't have to get involved with any of the financing, no loans. They would pay for it 100%. But then they also have supportive services that they can help you out with, like bills and stuff like that, while you're in the actual training. Between that 3 to 6 month period of training time, which we require 16 to 20 hours per week on average in order to remain full time. Now, there's another way to access those funds as well. If you fit into certain categories, for WIOA funds, there's also Native American WIOA funding. If you're a Native American Indian, Native American Hawaiian, Native American Alaskan, and you hold a CIB card, which shows your certificate of Indian blood, or another way to prove, your Native American heritage ID card. If you have that, then also reach out to me. And then I'll show you how to access that grant. They will pay for the funding for the program. We'll get you enrolled, and the placement assistance is included with any grant funds that we use. We're still going to help you get a job. It's included. That's part of what we actually do here at HTA. Now, there's also a few other grants that go along with WIOA too. There's some, if you're a veteran, you get priority funding, priority service too, there at your local workforce office, the one that's closest to you. Or if you're Native American, there is a priority for you if you go through the Native American grant funding sources that we have contracted with, or that we have an MOU, a partnership with. And then if you're between the ages of 16 and 24 and you fit either of these criteria, where you're pregnant or parenting, which means if you're parenting, which means you have custody of a child. If you're homeless, which means you don't have a particular place that you can call your own, you just living with your cousin or aunt sleeping on their couch or whatever, and you're between the ages of 16 and 24. If you didn't graduate high school, didn't get your GED yet, there's a way to start that process where they would actually access the grant funding and pay us directly for you to get the certification that you choose, and we would help you get a job as well. Or if you were between the ages of 16 and 24, and you ever were inside of the foster care system, whether you aged out or you're still involved with that, you would still be eligible to receive some of those fundings, and you would get priority services at your local workforce office. So I could help you obtain that. So let us know, because there's plenty of ways we have grant funding. If you're between the ages of 16 to 24, that we could help you access the funding. In addition, there's two more that I just found out about, that if you have ever been diagnosed with a 504 designation, which means that when you were in school, if they said, or high school, and they said that, okay, well, you've been diagnosed with 504, which is like, it could be similar to ADHD, or if you have, let's see, not a mental disorder, but if it takes you longer to process things, then you would have that designation. That also qualifies you for the youth grant as well. So you could actually use those funding as well if you had that designation for you. Now, being an adult, if you have any type of medical issues that they would consider a disability. Let's say asthma has been, I've seen asthma being used once before, or something that's chronic that you continue to take medication for and you won't be healed of it. Then the local workforce office also has funding. It's called state vocational rehab. That's under the WIOA umbrella as well. And I can show you how to access that as well. So reach out to me, because you probably fit somewhere into some of those, round holes, where we can help you get in there. If you collect TANF, food stamps, or on reduced rent, there is funding available through your local workforce offices in your different states that would pay for the program as well. So please reach out to us. We're here 8:30 to 5:30 CST, Central Standard Time, and I will do whatever I can to help you access one of those fundings and get you in the training program of your dreams and get your career started versus you having a job. That's what the credential does for you. It validates your skill set to a third party, which would be an employer, versus you not having the skill set. I could tell Donish, hey, Donish, I want to drive for you. And he's like, okay, Chester, well, sure, I've seen you drive up. You've been driving for 20 years, but where's your driver's license? I don't have a license, but I've been driving for 20 years. Not the same as having the credential. The credential is not HTA giving you the credential. That is a third party verification of the skill set that you access by taking the training at HTA. So therefore, it validates your skill set. So it makes an interview process a lot easier, because they then at that point they know you're qualified to do the job. Now let's just talk about if you can match personalities, pay, hours, and all of that stuff. So we're here to help. I look forward to talking to either one of you soon. Thank you.
Thank you so much, Chester. And Chester is here for the next 15 minutes, I believe. Chester, you're here, right?
Correct.
So at the end of the webinar, he will go over the questions that you guys have asked, and he will also answer the rest of the questions that you guys will be asking later on. And that takes me to the next part of our webinar, which is HTA Career Services. Now, career services, which I mean, all of you guys are here to find a job in the healthcare space. We want to help you with that process. But remember that we will not claim nor we will promise to hand you a fish. We will not give you a job. We cannot guarantee a job, but we can equip you with all those skills where you learn how to catch your first fish, which is landing your first job. And we will give you the network and referrals to our partners, everything that we can do in our capacity, help you with your professional profiles, to help you with that process. And that's all what we can do, and it depends whether we have affiliations in the area where you're based or not. So there are a lot of factors that contribute towards it, but we have a career services team which will be there to help you along the way. Now, when it comes to career resources and the support that is available, we have one-on-one career sessions. So the way it works is that once you're done with the 50% of your course, you will receive an email from the career services advisor, and you will be able to schedule your first career service advising session with them, and they'll walk you through the whole process. If you are enrolled in a program where externship is a requirement, or you want to find an externship role, they will walk you through the process of externship and how it is going to work out. It's a 15 steps process, 14, 15 steps process, And they will tell you that these are the parts where you will have to take the lead, these are the parts where we will take the lead, because the whole externship process is not that straightforward. Even if you have a clinical site ready to take you in, it will still take about 8 to 12 weeks to complete all the background checks and have an affiliation agreement signed between the clinic and the educational institute, which is HTA in this case. And we will have to complete all those requirements. And then we also have some additional requirements, like using a rota system. In some of the states, we have to get onboarded with that platform which they have, which is used to arrange the rotas for the students. So there's a lot of requirements. They'll make you understand which are the steps where you will have to take the lead and which are the steps where we will take the lead for you guys. But it has to be a mutual effort. The career services will be working towards it, you guys will be working towards it. It will take time, it takes time for everybody, but if you stay persistent, you can absolutely find a role. And then along with that, we have a career prep course at the end of every program, which really helps you learn some soft and hard skills which are very useful for you to become a well-rounded professional. And then we have professional profile building program, where your career advisor is going to help you with your LinkedIn profile, with your resume. They're going to give you scripts that you can use to reach out to the employers, whether it's on call or email. So it's really going to help you in a lot of ways. Then once you're done with your first career service session, you can also schedule the second session, where you actually start to talk about how you're applying for jobs, how is it going, what is the effort that you need from our side, what kind of things are you struggling with, what are your concerns, and everything you can share it in your second session. And then you can collaborate with the career services advisor to work towards your goal. And then in case you ever have any kind of interview or discussion with an employer, the career service advisor would absolutely help you prepare for it. And that takes me to the next part, where we have our student testimonial. So you can, oh, by the way, one more thing about the career services. And this is about externships, which I see that some of you guys already have asked a few questions about externship process. Now, I think it's very important for everyone to understand how the externship process is going to be for you guys, and where will HTA be helping you with it. We don't guarantee the externships, but we absolutely want to help you guys in every possible way. We have affiliations, but we cannot promise, and that's the reality. And we don't want to overpromise and say, oh yes, we are going to guarantee it, when we know that we have an affiliation in the same area, but they might not have enough spaces available, they might not be taking more externs on board. So for that reason, there is a video on YouTube. So search Health Tech Academy externship process, and you will find a video where I recorded the whole externship process and tried to make you guys understand how that whole process is going to be, and how we are going to help you guys through that whole process. So these are a few student testimonials. I'm just going to give you guys 10-15 seconds to go over these testimonials from our students. These are for medical assistant program, dental assistant, surgical technology. And then we also have this one video from one of our students. So I'm going to reshare my screen and share the sound, where she basically talks about, oh, we have a lot of students. We have Efta, Dominic, Kaylee, and Alex, all of these students. These two are for medical assistant. This is Kelly's for dental assistant. So I think I can share the recording for, like, I can play one of these. So let's listen from Efta. Can you guys hear it? Can you write in the chat box if you can listen to the video?
My name is Efta Deshwathobi. I currently live in Miami, Florida. My aim is to do surgical tech, and I was able to find that out through Health Tech Academy through a referral of my sister, which we both signed up at the same time, and I'm pretty glad that she did because of the help with Health Tech Academy, with the fact that it is accredited with NCCT, which was an important factor into signing up and getting the help that I was able to receive from the career coaches, from the teachers, the professors, things like of that nature has been instrumental in the success rate of being able to work in a hospital. Looking for accelerated programs, the health tech actually were able to pop up again. It was a referral, but she had to do the research, and from there, that's when she found out it was accredited through NCCT. When going through this, I definitely looked into it. I did my research and I asked plenty of questions. Don't be afraid to ask questions. And that's what made me feel comfortable. They are on top of it. Please do the work. If you really want this, just do the work. Know that you want it and just ask a bunch of questions. They are more than happy to help.
So this is, one of the students. You can find all these testimonials on our social media and YouTube. So I'm not going to play all of these because I want to give the time for the question answer session. So feel free to use the chat box, ask any questions that you guys want to ask. And while I go to the questions, I'm going to share these 3 QR codes here. You can visit the website by scanning the first QR code. You can schedule a session with the with the admissions team by scanning the second QR code. And you can also give them a direct call using this number or this email. And if you are unsure which program is right for you, you can take our career assessment quiz, where we will give you a recommendation on the basis of your answers in this career assessment. Now let's go to the questions. So I'm going to go on the top. Will offer a grant? I think Chester has answered that question. I saw it at the start of the program. Do you offer respiratory care? We don't offer respiratory care. How do we complete the clinical requirements? I think I've kind of talked about it, but I absolutely would recommend you guys to go on our YouTube and search for externship guide Health Tech Academy, and you will find a video by me where you'll find all the details. And I'll also request my team to send you all a video for the externship process, because I think that's a concern for most of you guys. Clinical case, what is a clinical case? I think I answered that. Do you offer help with placement for the externship? Absolutely, yes. We will do everything in our capacity to help you with the externship process. But the only thing that we cannot do is promise an externship. We promise all the help, we guarantee all the help, but we cannot guarantee that there will be an externship waiting for you as soon as you're done with the whole program. It will take time, but if we work together, the career services team will be there. You will work hard. You can absolutely find the clinical sites. When doing clinicals, are those covered through HTA, or do we have to look for that ourselves? So that's exactly what I'm saying. We will look out for you guys. You guys look out for yourself as well. And whatever works, you may find the clinical site first, or we find it first. Whatever works, we will go with that option. I already have my enrollment letter for patient care technician program, but I haven't been able to reach out to the career coach for a grant. I was told I need to fill out some papers. So is there a way someone can help me? If you're talking about one of the funded programs, then you probably need to reach out to our team again, maybe reach out to Chester. He had his contact details shared. But if you are enrolled in another program, you can reach out to the career coach once you're done with 50% of your program. So I think you are probably talking about the grant. So you need to reach out to the team that enrolled you, and then they can assist you further. What are the clinical hours for phlebotomy technician? What is the website? You can find this information on the website. The website is healthtechacademy.org. I can type it here in the chat box so all of you guys can see it. So I just send that. Chester just shared his contact number. Can you send us the recording? The recording will be available on YouTube, but I think the team will also be sending it to you guys. There is a discount for all of you guys, and you guys are eligible for a really good discount, and you guys will receive an email regarding that as well. For medical assistant, how would I get my clinical learning time? So again, we will assist you with the clinicals if you want to do the clinicals, although for medical assistant program, you are not required to do the externships. You can complete the program and start applying for jobs. Yes, I have asthma and been taking medication for years, so you might be eligible for one of the funding. So better schedule some time with Chester. Does having a learning disability qualify you? Okay, Chester already answered that. I missed the Surge Tech part. How many clinical hours do you need? So for Surge Tech, it's not the clinical hours, it's the clinical cases, and you need 125 clinical cases. If you need more information about the clinical cases and the help that we will offer in terms of the externship process, you can email me, you can email the admissions team here. You can see the email for the admissions team, and they can share all the documents related to the externship requirements for Surge Tech. So that will be very, very helpful. Are the monthly payment approved based on your credit? That's correct. They are. All right. Is Maryland eligible for surgical tech? It I feel it is. I can give you the final answers if you give me 1 second. I will open my sheet to confirm if Maryland is okay to uh, go for search tech. Let me see. Maryland. Yes, it is. So you are good to go for search tech for in Maryland. Uh, I have not found clinical hours for the phlebotomy tech. You haven't found the phlebotomy tech clinical hours requirement on the website? Okay, just give me a second. I'll tell you that information myself if you cannot find it on the website. Phlebotomy technician. And okay, so I think you guys can see it on my screen. These are the clinical requirements. So these are these are 40 you can say procedures that you guys have to perform within 180 days of passing the CPT exam. We recommend that you complete these requirements first and then appear for the exam, but you can do it other way around as well. That's not an issue. All right, I don't see any further questions right now. And we are exactly on time. If you guys have any other questions, we are here for another minute. And if this is it, thank you so much for joining. Thank you for taking out the time. And we hope to see you on the other side. We are here to help you in every possible way. This is your chance to take the first step towards a successful healthcare career. Thank you so much, everyone, for joining in. Signing off. Take care, everyone. If you need any other information, feel free to reach out to any one of us. You have Chester's email, you have our admissions email. Take a screenshot of this screen that you guys see right now. I will leave it up for another 10 seconds or so. But I really, really hope to see you guys on the other side. All right, everyone. Take care. Bye-bye.